I got it. I have the CMS 2567 Statement of Deficiencies Plan of Correction form for the accident for the patient who had a transesophageal temperature probe. You know that this illustration isn't a TE temperature probe, but that shows something going down the patient's esophagus into their stomach. This is essentially what the temperature probe did, right? And the patient was imaged on MRI with the temperature probe in place, and the patient got burned as a result of it. Now, people alerted me to this incident in October of 2024. And the information that I had at that point was that it had happened, within a few weeks of when I had been alerted to it. So that would have put it in September. Turns out, however, now that we actually have the report with the documentation, this accident happened in April of 2024. Have not yet done sort of the full breakdown, cause and effect, but I have distilled a handful of bullet points that kind of describe this particular accident. And I'm going to go through them. I'm looking off to my notes. I'm going to go through them with you now. So the patient who was burned, this was actually the second MRI study that they had, right? So they had an MRI the day before, and it appears as though the esophageal temperature probe was placed between the first MRI exam and the next day MRI exam. So the patient had had a brain MRI the day prior to the MRIs where the patient was injured. The esophageal probe was placed presumably after that first one. So the MRI study where the patient got injured was a two-station study. So a brain is one station, but then they felt like they needed to image the patient's thoracic and lumbar spine, middle and lower back. And so the exam in which the injury occurred was actually sort of two exams back to back. So a single sort of time on the table in the MRI, but they have to kind of move you and adjust so that they can take images of different parts of your body. The sites, the hospital where this was done, their MRI safety policy indicates that it was, quote, last approved in July of 2019. In the body of the policy, it said that the policy needs to be reviewed and updated on at least a 3-year cycle, which would have been July of 2022, but there was no indication that the policy was reviewed or updated in the policy indicated time frame. The MRI safety policy indicates that it was aligned with the 2013 ACR guidance document on safe MR practices, which was the current version when the policy was last reviewed and updated in 2019. Had they done an update as the policy indicates in 2022, there would have been a newer version of the ACR document. Nothing, I think, sort of critical between the 2013 and the 2020 editions of that document. All of the ACR's MRI safety documents provided screening forms from 2013 onward. All of those documents include esophageal probes as one of the things to specifically look for. This particular hospital did not have esophageal probe on their MRI screening form. For inpatients, nursing was supposed to perform the initial MRI screening up on the floor. As I said, the screening form did not include a prompt for an esophageal probe, although the ACR screening forms, the prototype screening forms, did have that as a checkbox item. The policy governing screening of inpatients stated that screening form is the final safety checkpoint and that it would be filled out by the nurse who would go through the questions. The language of this seems to suggest that the nurse has final say about clearance or non-clearance of this. That may just be a language issue. It may be poorly structured language in the report that doesn't accurately reflect what site policies say. We're not exactly sure on that. Now, the MRI tech reviewed the screening form, which, as previously mentioned, did not have a place to indicate the probe in one of their standard checkboxes, and there was no note of it. In fact, the nurse who was interviewed after this event said that at the time she was unaware that there was an esophageal temperature probe in place in that patient. The MRI tech, finding no mention of it on the screening form, purportedly did a visual inspection, but according to the 2567 report, the wire, the lead coming out of the patient's mouth was obscured by the bundle of stuff. So the patient also had a trach tube, a breathing tube down their mouth, and then there's tape to essentially hold that in place. And so the temperature probe wire came out, and there's tape, and there's tube, and there's other stuff. And the MRI tech said that they looked, but they weren't able to visually distinguish the wire coming from the esophageal temperature probe. There's also mention of using a metal detector, a handheld, wand-style metal detector to screen the patient, but there's no information about what kind. All metal detectors like TSA uses have been explicitly recommended against for screening of patients in MRI, recommended against in ACR MRI safety publication. So if they used a ferromagnetic detector, that would not necessarily identify a wire or a lead, because most of those have little, if any, ferromagnetic content. Following up after the exam, I had, in previous statements, this is what had been shared with me, been told that the patient's esophagus was burned. The information from the state report clarifies that a little bit, and it indicates that there were burns on the patient's lip, tongue, hard and soft palates. So essentially the entire length of the mouth back into the throat. If it describes burns being severe enough that the patient was going to need plastic or reconstructive surgery to repair some of the burn damage, that part of the lead assembly for the esophageal temperature probe was melted and fused to the patient's tongue as a result of this. In the document, it talks about there being updates after this accident to the hospital's policies and procedures related to MRI and MRI safety. There were some things that were done immediately after in terms of training and additional education, but the MRI safety policies, that update that came presumably as a product of this accident, didn't happen until December, about more than 7 months after this accident occurred. In the report, there was no information provided about MRI safety governance structures. Did the facility have an MRMD? Did they have an MRSO? Who individually was responsible for MRI safety clinical practices? Because this is most definitely a clinical process safety aspect. So again, that's a just the facts, ma'am kind of rundown of this particular accident. We're going to be doing some further digging in, me and a colleague, Bob Latino, with whom I've done other root cause analyses, and we're going to try and dig a little bit deeper and get into the latent and human causes of this particular accident as best we can. Stay tuned for more information as we have it available.